Hello, I'm Dr. Kenneth Eguda, consultant gynecologist and an IVF specialist. How can we make the IVF treatment cycle safer? That's what we're looking at in this episode. We understand that IVF treatment cycle could be associated with some complications. The first IVF treatment that was ever done was an IVF treatment cycle using the natural woman's cycle, the natural cycle of an IVF treatment. In this kind of cycle, no medications are administered. The single follicle that a woman generates or develops is being monitored, and it is retrieved when it is deemed to be matured. A single oocyte is treated and a single embryo transfer is done. By this means, there is no excessive load of medication or physiologic load of any sort added to the woman. It follows a natural body physiology. This was the first IVF that generated the first IVF baby in the world today. Today, there are people that have cancers, also metabolic diseases that could not withstand the rigors of heavy medication as it's usually seen administered in an IVF treatment. They could be good candidates for the natural cycle IVF. Another way to make an IVF treatment cycle safe or safer is to adopt the minimal stimulation IVF. In this kind of IVF treatment cycle, little quantities of medication is given to generate maybe 2, 3, or at most 5 oocytes during this treatment cycle. The load of medication and the physiological alteration of the female system is minimized in this cycle. The most dreaded complication in an IVF treatment cycle is the ovarian hyperstimulation syndrome. It can be deadly and it's a feared complication. By doing the natural cycle treatment cycle or the minimal stimulation IVF treatment cycle, the most dreaded complication, ovarian hyperstimulation syndrome, is being minimized. Another modality that we could adopt to ensure safety in an IVF treatment cycle is restriction of the number of embryos that are transferred. Restricting embryo transfer numbers to 1 or 2 embryos per client minimizes the rate of having multiple gestation, because multiple gestation or higher order multiples complicates a woman's life, complicates the life of the fetus is being carried, and of course it has a huge financial implication that may equally be termed as complication of an IVF treatment cycle. Some other modalities that could be used could include adequate screening of client before embarking on IVF treatment cycles, and any form of disease condition, whether hypertension or diabetes, should be brought under control before administering an IVF treatment cycle. That way, it is safer going through the IVF treatment cycle. These are some of the ways that an IVF treatment cycle can be made safer amongst all other modalities that are available. You could get more of this information from our website, or even still visit our facilities. Until I come your way next time, I'm Dr. Kenneth Eguda, consultant gynecologist and IVF specialist. Thank you very much for viewing.